Let's try to go live. I think. Let me know we're live. And we'll be.
Where's live?
It says we're live, but do you need this?
No.
Oh, I need this. Wow.
Sounds relaxing.
Botox. Yeah, should be.
Okay, where are we going?
Should be in there. I mean, what time is it? Yeah, we got 4 minutes before we start.
Okay.
I wish I could have every control of everything, but I can't.
Don't worry about it. You know, I wish you would move this.
Do you want us forward?
Yeah, I mean,
A little more?
yeah, you seem so far apart.
Well, that's
Well, do you?
This?
Well, you can see how it looks. Do you?
yeah.
Oh yeah.
So you're watching
I
the
forgot.
live.
Yeah, you can see
I know, but I want to see.
Can you hear us? Go to the next room.
Oh, wait.
Okay, so we want to silence that.
She wants me out of here.
No, I don't want you out of here. No, I want you to silence that. Yeah, we're good.
Oh,
I just
yeah.
wanted to know.
No problem.
To silence that because otherwise it's going to be an echo.
It should be. It should be right.
We have Janet behind the scenes just
Hang on. It should be
helping
right
us
down
out,
here.
making sure that, you know, no, actually you can hear us, see us.
Where is the little?
Oh,
icon?
just the volume on your phone. Normally when you
No,
mute
no,
that.
There's a little icon thing that lets you do
Yeah,
that.
I don't know. I would just do that.
Okay.
Does that make sense?
It's
We'll
tough.
start.
It's a tough technology business.
It's tough technology. We try to make it as we can.
Yeah.
Yeah. All right. I don't know what I got on my pants today, but
Having too much
There it
fun
is.
for breakfast.
you know, maybe I did. What did I
That's
have for
okay.
breakfast? Oh yeah, I had eggs and tortillas.
Oh, that's
Pretty normal.
delicious.
Put some jalapenos in
Oh,
there. It's like-
jeez.
it's very Mexican.
Yes, that starts your day off right.
Yeah, that's how it should be.
Go.
your get your
Jalapenos.
protein, your carbs, your
Okay.
veggies.
Yeah.
It's all good.
Take it.
All right, I think. I don't know. We still have 2 minutes. We're just testing out the waters here, making sure that it's all good. So,
Mhm. Beautiful
By the way,
day.
did you check with your insurance?
I haven't gotten that far
Okay.
yet. Nope.
We won't talk about that today.
Yeah, haven't gotten that far yet.
Let's see. Okay. So, yeah, what we'll do is just do this questions and then see if anybody else wanted to answer a question. We'll
Yeah.
do that at the end.
Mhm.
So no one, the questions that are coming in here, you will not be seeing.
I will not be seeing them. Let's see.
It's my
That's-
job, just double checking.
What would I do without Janet?
Oh, yeah, I don't. You're so sweet. She's wondering, I don't know. I'm a good odds and ends girl.
That's fine. You
Yeah.
need that.
Yeah.
Mhm.
The only thing that I have trouble doing, she does.
There you go.
She goes, like,
Support.
We
I
work
don't
it out.
know this typewriter.
Yeah.
You do it, Janet.
Need a compliment.
Give me that.
Mhm.
Let's go.
It's a typewriter. I don't know. No, I know. I'm in the generation of the transition. I actually had typewriting classes in
Mhm.
school.
I did too.
got that.
When you were going
it's
through
like-
school, it was called keyboarding.
Keyboard. I don't really remember what they were called, but I mean, it was like 1 year was that, and 2 years later was computers. Like
Yeah. see,
you're not using that anymore, basically.
What was so interesting for me, when I was in college, we were not using computers. When I went back for my master's, it had all changed. It was like, even the library had gone computerized, because I went back to the same university. And it was like, oh my God, I'm not in Kansas anymore.
Yeah.
And
All right.
so,
All right. So it's 11, and I'll try to get this questionnaires. Welcome everyone. If you are watching from your home, I hope you have a little cozy drink and you're comfy at home watching us. We're gonna introduce a new friend here, Laura Goll.
Hello.
So I actually don't have a bio. I should have asked for a bio, but
Oh.
please introduce yourself. Like, who are you?
Yeah, that is a great question. Perfect place to start. So I'm Laura Goll. I'm a dentist in Land O'Lakes, Wisconsin. Born and raised in Land O'Lakes. Did my undergraduate work in Madison. Went to Milwaukee for dental school, and then came back up north to practice dentistry with my dad in Land O'Lakes. So I'm part of Schindelholz Dental, so that's my maiden name. And I initially got into Botox or neurotoxin because I was myself getting migraines. And I had heard from another practitioner that it was a good place to start for tension migraines. So I started doing that, had excellent results, and here I am and providing it to patients and other people. And I've just really found a passion for it, and the aesthetic kind of side of it and cosmetic and how it fits in dentistry has really been a fun complement. So that's me and where we're at.
All right, awesome. Oh, there you go. Okay. Managing the camera, managing everything. It's fun, but it gets a little tricky sometimes. All right. Well, I have a few questions, and these are questions that come from, I don't know, I think everyone has these questions, but also my husband jumped in, Janet jumped in, my mother-in-law jumped in, and hopefully our viewers today will jump in and ask questions that we don't have right here.
Yeah.
But the first question would be, what is Botox?
Yeah, so when people say Botox, that's kind of like calling facial tissue Kleenex. So it's the brand name for botulinum toxin, which is a neurotoxic protein. There are other brands of this neurotoxic protein, which are Dysport and Xeomin. So depending on the provider you go to, they'll do one, all three, two of those different options. It just depends on their comfort and the patient. So you'll kind of talk with someone regarding that. So for the purpose of today, we'll use Botox just because it's easy to say and everyone knows what it is instead of saying a neuromodulator toxin. So that's what Botox is.
Okay, that's a good explanation. What is Botox used for?
Yeah, so how I use Botox in my practice is to decrease the appearance of facial wrinkles or wrinkles on the neck. And also, as I had mentioned before, for some migraine cases, again, it depends on where your migraines are coming from, how those are created. Other practitioners, like a medical doctor, can use or do use, it depends on the facility, Botox to decrease excess sweating, lazy eye, muscle spasms. So there's all different parts of the body that Botox can be used. But in my field, I use it from like the neck up. So, yeah.
That's very interesting because usually we think of Botox in the beauty industry as something to help with anti-aging or healthy aging.
Yeah.
But as you said, I've discovered that it's not just that. It has a lot of other benefits to it, which are quite important. And if we know that there's a solution out there, that is kind of exciting.
Yeah.
Okay, so how does it work? How does it really prevent those, or what does it really do?
Yeah, so the nitty-gritty science behind it is the toxin prevents the release of the neurotransmitter acetylcholine at the muscle synapse. So what that does is it temporarily relaxes the muscle from firing. So for people who constantly make the angry face or are very surprised, it doesn't allow them to make that motion, therefore decreasing the crease that they continue to get in their face. So if you're not able to crease, it softens that tissue, allows it to kind of regenerate and not have that in there. So, and it is a temporary thing. So after about a 3-month mark, your body recreates those connections and everything's back to normal.
Back to normal. All right. So, yeah, because the way I've explained it to people is that it's like a piece of plastic. if it's straight, it just stays smooth like that. But if you start moving it, you start creating that crease and breaking
Right.
that that piece of it and creating this line. And that's exactly what happens with our skin when we're making expressions. We are moving it and creating those lines.
Yep.
And as we age, all of our regeneration and elasticity of our skin breaks down, or just it's not working as well anymore. Therefore, it's not returning to its natural or normal or
Right.
beautiful, smooth appearance.
Yep.
So I think that's that's a great great addition. And honestly, we'll probably talk a little bit afterwards, but like there's this peptide that helps that function, because it kind of works like Botox that prevents that neurotransmitter from sending the signal,
Yeah.
but it's not as effective. So we'll talk about it a little more. Okay. So who is this for? Excuse us. Who is this for?
Yeah.
Who's
So
to be a candidate for Botox?
like on label, it's for anyone over the age of 18, but really it should be identified to the specific individual. So, and what you're looking for. So a lot of people use Botox as a preventative measure, or if they've already started to see those lines and wrinkles and they want to decrease that appearance, they'll start. So usually we'll see people in their 20s, 30s that are being critical of their face and see the lines on the forehead, between the eyes, around the eyes. So that's a good time to start to help keep those lines very, very soft and minimal. As we age, they're already ingrained a little bit, so that's a time where you start it and it allows them to soften. It doesn't decrease them entirely. So that same concept of when you're folding that plastic, I usually liken it to when you crease paper, so you can rub it out really well, but you always see that little fine line there. So that is what gets us into that kind of category of, you start with Botox as a first-line defense, or maybe go to this peptide or other kind of facial treatments to complement that, kind of a combination therapy to get the result that you're looking for. So
Right.
really anyone over 18, but again, you want to make sure that you're kind of having that conversation and figuring out if it's right for you. So,
Right.
yeah.
All right. So who is it not for? What are the contraindications?
Yes. So hard nose on pregnant or nursing, just because no one's doing studies on that, which
No.
is, you shouldn't. So that's just a good one not to. Also, people that have neuromuscular disorders, because this is decreasing neurotransmitters, you want to make sure you're not disrupting anything there. People who have any allergies to botulinum toxin or any additives, there's all different ones. So what you do is we'll take an intake of kind of your medical history and figure out if there are any pre-existing conditions that could be an issue or complicated with Botox. If there's any question, your provider will reach out to your medical doctor and have that conversation to determine if that's something that's beneficial or not going to be helpful for you.
Okay. So there's a lot less contraindications that I thought there
Yeah,
was.
there aren't too many,
That's good.
but
All right. Does it hurt?
okay. So broad question. Everybody's pain tolerance is different. So again, when you have that kind of intake consultation, we talk about your pain levels. How much pain you can withstand, but really Botox is administered by a very, very tiny gauge needle. And it is in multiple areas of the face, but we make sure to use a needle only once or a few times in the skin. Obviously every person has their own needles, because each time you place that needle in, it does get dulled. So that is one thing that I personally do, because I have a phobia of needles, but am able to take on Botox. So that helps make the process as painless as possible. We also can apply like a topical numbing agent for people that are really nervous or have a high or a low pain tolerance. So again, it's that discussion of, what can you withstand? Do you want to try it without? You can always pause and put that numbing agent on, and the area we're treating. So lips are a lot more tender than, say, the forehead. Around the eyes can be tender for people, but that also It depends on your skin type. So yeah.
Okay. So here's another question. Like, what on the face? What you said there's multiple areas.
Yeah.
The most popular one that I found is right here.
Yeah.
The 11th, as they
Yes.
call it. Where else do you apply?
Yeah, so let's start on that upper face portion. So yeah, you can have the 11th, which is caused by that angry face. You have the forehead, which is the frontalis, which is this whole kind of fan of muscle up in this area with that surprise face. There are the smile lines, or crow's feet we call them, which is the squinting on the side. And again, too, there are all these areas, but I don't be like, oh yeah, let's do them all, because some people love their little smile lines, or like, you know, it took me years of laughing and engaging to create them. So you know, just because you have them doesn't mean that that's something we need to treat. They're called bunny lines, so people who kind of squint in this area here.
Okay,
So right by the nose is a muscle so there's a muscle created there. Some people if they have like a really pouty face, you can get kind of downturn of the lip from some muscles in this area. The chin, which is an interesting one. So as we age, we kind of get a stronger chin, and it creates little dimples in this area, so that can be relaxed that way.
Oh, okay.
Some people have a very well-developed angle of the jaw from clenching or grinding, so another kind of reason that I got into Botox, because that's 100% my field, straight up. And women don't like, they're kind of tending to want a more squared off jaw, but you don't want this like huge muscle here. So sometimes you can decrease that activity, which gives kind of a slimming appearance of the face.
Okay.
Around the lips for water bottle lines.
Water bottle lines, so it's like that smoking lines? Or just like,
Yeah,
okay,
so we more kindly call them water bottle, because we do find that a lot of women who are, or men who are going into facial care, you know, they aren't smokers and they have really good home care, and a lot of the lines around the lips are either caused by lack of collagen in the lips, you know, sipping on a water bottle and not necessarily smoking. So we've kind of transitioned into that water bottle or straw line instead of the smoker's line.
Perfect. See, I didn't know that.
Just being,
All right. So I've seen on TV and movies that they have this exaggerated look when they do Botox.
Right.
And I'm wondering, like, where does it come from, and how much of that is true?
Yeah, so Hollywood is awesome at being overdramatic. Just like dentists are these like terrible people that have gory, bloody procedures that are mean, we're not. Maybe there are some dentists that are like really terrible. So I'd say maybe there's 0.01% truth of that. So ultimately, yes, what we're looking for with Botox is to decrease that muscle activity. So sure, if you don't want to make that angry face, we can 100% make that go away. It's not that you're froze in the like wide-eye position, because that's actually active. You're just more relaxed. And some people decide that they're like, no, I want a little bit of activity in my angries because I need my kids to know I'm mad at them or something.
Right.
So there is this kind of concept too of, you know, making sure, or some people want to make sure they can still have that activity, and that's just totally dose dependent. So I think Hollywood goes that extreme to get that humor out of it, or just that wow factor of like, what? So a little bit of truth, but not much of
Not really. Okay. Now, here's a question from my husband.
Oh, yeah.
He had this whole explanation, but basically it sums down to, is Botox addictive?
No, so it is not chemically or physically addictive.
Okay.
Like nicotine or anything like that. Absolutely not. What people do find is when you start to use Botox, and you get that end result of a more relaxed face or a feeling of more refreshed or not getting those headaches, it becomes part of that kind of self-care routine, just like getting your hair cut or getting your nails done, that you appreciate doing for yourself every 3 months. So, you know, maybe that psychological addicted factor of I love how I look, I feel confident, but no physical like withdrawal or issue.
Right. Yeah, and there's this question also with chapstick.
Okay,
or like lip balm. People will feel like they're addicted to it because they feel like they have to reapply more and more and more, and when they're without, then it creates their chapped lips, basically. But there's also no actual addiction to that. It's just you get used to the feeling, used to having the benefits of it.
Right, exactly.
All right. Now, you already answered this one. When is it a good time to start Botox? Is it around 18, maybe 20s?
Right, you can start at 18, but again, it depends on how expressive you are. So, like, I have an assistant who, I swear, I mean, she's beautiful, makes expressions, but has no lines. So I'm like, no, we're not touching your face, nor does she want it, which is great. So, and she's in her 20s. So again, it's that concept of tailoring it to your age. Just because you turn 18 doesn't mean go out and, get Botox. It's, see if it's a right fit for you and what you're looking for.
Very individual decision.
Yeah, for sure.
All right. So what does the whole process look like?
Yeah.
If I go in and this is my day of consultation, what do I expect?
Yeah, so expect for that consultation appointment. Perfect. So yeah, when you come in for a consultation, we're going to have you fill out that full medical history, again, to figure out any allergies, any medications you're currently taking, again, those pre-existing conditions, and we'll go through any of that and make sure there aren't any issues or contraindications to receiving Botox in the future. And if there is any question, we'll explore that together or reach out to a medical provider or your MD. Then I'll give you a mirror and you're just going to look at your face and you're going to be self-critical because that's why you're there. And you're just going to explain kind of the areas of concern, what you're looking for, what you're hoping to get out of Botox treatment. And depending on the areas that you show and we look at, we'll determine and we'll kind of set expectations of, is Botox going to give you that desired end effect that you're looking for. So a lot of times I find people come in and they have a little bit of a skewed thought process between Botox and a dermal filler. And they'll point to an area and I'm like, that's a dermal filler, which we can do, but you're not going to get it with Botox. So sometimes it's a combination therapy of Botox, a filler, coming and getting, routine skincare treatments, depending on your type of skin, the skin damage. Why you have your wrinkles is another reason. So is it due to expression? Is it due to skin laxity because you've lost collagen in areas that you had in the past? So there's a very kind of thorough conversation regarding those expectations and what I can do for you if we need to refer you to another provider to have that kind of combination therapy. Then we take a full kind of set of photographs in different kind of positionings of the face to kind of have a baseline of how you look, talk about kind of the amount of units or areas that we're treating and what type of products we're using there, any cost estimates that might be associated with that, and then get you scheduled for whatever time frame we feel we need based on, the procedure that we're going to have.
So on the first day, you would not actually inject anything.
If I always like to set the expectation that no, I will not be doing anything the first day. But if it is something that we find is simple, you have a pretty clear medical history, the areas are minimal and we don't have to work with a dermal filler, then sometimes we can inject day of. But again, I like to not set that expectation just because it could be more involved and we don't want to rush it. We want to make sure that everyone's on the same page, both time frame, monetarily, physically. You can't have any skin infections. So, yeah.
Yeah. Emotionally.
Emotionally, right. And it's kind of managing all of that and figuring out.
For sure. It could be kind of scary, especially if you are afraid of needles.
Yes.
Me, like you,
just
like we are. Yeah, and you actually touched a really good point of setting expectations. A lot of times we kind of go in thinking that all of our lines and sun damage and everything that we've done for years is going to get fixed in one treatment.
Right.
And that is
Not true.
Not true at all. It takes time, it takes
Right.
consistency,
Right.
and it takes care. It doesn't happen in one treatment, and also we can't go back in time. We're not
Right.
like erasing all the damage.
Right.
It's helping to either reduce. Sometimes it depends on how long you've had the damage that how much we can really reduce. So yeah, that's a really good point. So
Yeah.
people know what they're getting into,
Right.
basically.
Mhm.
Yeah. Okay. She's been doing the precision consultation application. Okay, so that was just the first consultation.
Yep.
How it looks like. Now, I'm ready to come in for injections.
Yep.
How does that look like?
Yeah. So once we've got all that consultation out of the way, the injection appointment is shorter, usually, or depending on, how many areas and sites we're doing, or if it's combination therapy of, filler and Botox, usually we'll split those up. But you'll come in, we'll cleanse the face in the areas that we're applying the Botox, we will always cleanse it, and it's up to you if you want to come in with makeup on or not. We'll just be removing it in sites. Then we'll take a full set of images again, kind of at the day of. We'll make little markings on the face at the sites that we're injecting, so we have a reflection process. If we really loved that end result, we'll try and always kind of continue with where we placed it, so we have that documentation over time. We'll apply any numbing agent or use any distraction techniques if we've already identified that that's an area of concern. Give time for that numbing agent, whatnot, or cooling, and then send you on your way. Before you leave, though, we want to make sure that you have a follow-up with us 2 weeks after. At that point, we will take images again to show kind of that before and after. A lot of people forget what they looked like before.
Oh, yeah.
And it's a beautiful representation of here we were and here we are. Like, wow, I love it. It's one of the most fun things, making a side-by-side. I always tell people in that 2-week waiting period is to not love it or hate it for 2 weeks. So Botox itself will take about 5 to 10 days for it to start to take its full effect.
Okay.
When it's decreasing the muscle activity of the targeted muscles, other muscles will start to recruit and reactivate to try and supplement what was lost. So in that time frame, you could sometimes get this asymmetry, might look a little wonky, but your body's readjusting to that decrease.
Okay.
At that 2-week mark is where we'll look and see, are there any asymmetries after everything had, figured itself out. Sometimes what we find is it's called a Spock brow, but when people get their forehead relaxed, because that frontalis is such a fan of muscle and it extends all the way out here, you can get one brow that sits up a little bit higher after that process. So you just add a little additional toxin in that area and relaxes it. Some people love that kind of arching of the brow to give them that brow shape, but that's something that we look at that 2-week follow-up. So again, it's not just to take the photos, but do any adjustments if you either need additional or some changes, because especially with patients first, I like to err on the side of less product because you can always add more.
Right.
You don't want to have too much and then you've, over-relax things. So just err on the side of caution. But once we find a formula, it's just the same thing every time.
Yeah. Perfect.
Yeah.
Sounds normal. No, I do that with my clients too. I like to err on the side of caution. Sometimes they have been training their skin to take harsher procedures, and then they skip for a few months and they come back and they want the same thing. I'm like, we're gonna have to start over again a little more. So we always want to do that because it may not seem like a lot to go that harsh because you've been there, but it is. Basically, there's no more explanation. It is. Okay, is there any way or anything that I need to do before my appointment?
Yeah. So usually we recommend people not have alcoholic beverages 24 hours prior, but a glass of wine or a cocktail or two is not a big deal. It's hitting it hard the night before is what's going to cause that blood thinning and maybe increase your risk of bruising at time of treatment. Another thing that I always want to make sure people are doing is not scheduling it close to an important event.
Okay, yeah.
So one, because you can have bruising, so you want that to go down, swelling, you want that to go down. And two, Botox itself will not take effect until that 2-week mark. So if you've got a wedding in 2 days and you're thinking, oh, I'm going to get Botox, no. You're going to still be doing the same motion in those 2 days. So one, to let things settle down, and then two, to have things in effect. You also want to make sure, and again, this will be a conversation with the intake of your medical history, that you decrease any or stop taking any blood thinners or anti-inflammatories, which can cause increased swelling or bruising. But again, people who are on really heavy hitters like a warfarin or a Coumadin, no, we don't want to take you off that. It's more of like a management, again, setting the expectations of we could have some pretty aggressive bruising, or is this maybe a treatment that might not be ideal for you based on the medications you're taking.
Okay.
So yeah.
All right. Now, what would be the aftercare instructions?
Yeah. So directly after treatment, you want to make sure for about 3 to 4 hours you're not having any vigorous activity or exercise, just more kind of keeping that heart rate down. The higher our blood circulation is, the more likely we are to actually wash away the product that we just put in, so the Botox we put in the face, and it won't have as thorough of effect. Also in those 3 to 4 hours, you don't want to manipulate the face. So no washing your face, no getting any dermaplaning and chemical peels, no one really touching. You want to make sure too, you're not putting any hats, sunglasses, goggles, objects on the face, because we've specifically placed these boluses of, so the little bits of liquid and the Botox in there. So if you're pressing that tissue, you can actually reform it into areas that we didn't want it and getting facial expressions that we weren't looking for. So, not falling asleep, not manipulating the face. And you don't want to apply any makeup or lotions or product if possible, because if you think of it, each injection site is a small little puncture wound into the skin. So we don't want to put any products or chemicals within those little wounds while they're healing. If you absolutely have to wear makeup, you can compromise and purchase a fresh makeup that will have less bacteria, hopefully. But ideally, it'd be best to just kind of schedule your appointment on a day for you and just make sure you can kind of relax after it.
Yeah, actually, we were talking about this the other day, how it would be best if you're going to have some skincare procedures, just schedule them 2 weeks after your Botox appointment.
Yeah.
Just because of the manipulation that goes on. All right. How often do I need to reapply?
So 3 months. So it's Botox has like a tapering effect. So it takes about the 2 weeks for it to hit its maximum kind of effect. And then slowly you'll see your muscles kind of regroup and recuperate after that 3-month mark. So at 3 months, everything's about back to normal. And then if you loved it, you do it again. If there were any modifications, if you didn't, then you just don't do it. But that's kind of the nice part about Botox is if there was any adverse effect or you weren't loving it, it's going to go away. It's not a permanent, procedure. So that's kind of a nice fail-safe.
Yeah. It's like haircuts.
Yeah,
I mean,
I
you
know.
cut too much, it's going to grow back.
Exactly.
No
So
big deal.
just time.
All right. What is the range of cost?
Yeah. So again, totally person dependent and how many areas you have on the face. So Botox is unit dependent is the way we do it. So each unit you place has its own cost. Again, dependent on the product too for some people, some practitioners. And then, so like I did my mother-in-law and I did 50 units on her face, but they were all separate areas. You can even do more. For people who are like really active, in this kind of angry or 11, 20 is usually, 20 units is like a basic starting point, and usually that's around like $300. From there, it all again depends on kind of how your eyes are shaped, how your skin is, sitting on your face, how many units that we start with. And why I say that is, so some people have what we call hooded eyes. So their kind of brow tissue is a little bit over their eye. You want to make sure you're either doing no units on the forehead or really less as compared to someone who has deeper set eyes without that tissue. So again, and what you're looking for. If you still want to have a little motion, then it's going to be less. So it's very variable.
Very person dependent.
It is so person dependent, which is so fun.
Yeah, it's like a little puzzle.
It is.
Yeah, that's how I feel it. Like, yeah, I feel that with everyone actually. Okay. What would be the side effects and risks that I need to keep in mind when I'm getting this treatment?
Yeah. So the side effect and the intended side effect is to decrease that muscle activity. So relax that. So you're not going to be able to make that angry face you want or raise your brows as much as you want, which is purposeful and what we're going for. And again, we kind of manage, do you want no movement? Do you want a little movement? So we want that. The risks, I would say, are obviously bruising. So we're pretty vascular around our eyes, our forehead. I personally have a really big vein that runs through my forehead. And, I can get sometimes and get a little bruised, but it'll go away. At times, too, in applications in the forehead, people can get some low-grade just headaches just because of the proximity of the tissue to the bone. If you touch the bone, you can get a little bit of irritation that way. The other risks are because we're relaxing muscles, you can get, as I was talking about, kind of that hooding of the brow over the eye. So it kind of drops a little bit because we're not allowing those forehead muscles to move up as much. And in rare cases, people can get kind of relaxation, or it's called ptosis of the eyelid, where they can't even open their eye much. But we take care in dosage, placement, how we hold the tissue to decrease those risks as much as possible. But
there's still a possibility.
Still the possibility, and we usually review that. And, that's why we kind of talk about not manipulating the face and dosages and things like that. But yeah.
Okay. Yeah, I've seen my mom. She looked weird. She had this area a little paralyzed. And she had gotten Botox here. And I'm like, Mom, stop going to the doctor. I was like, I don't know what they're doing to you. But like, I don't get like how from here it paralyzes here.
What? Oh, that's weird.
Yeah,
Did they put any here?
Maybe, and she didn't tell me. I was like, what did they do?
Yeah,
so
that is one thing too. Usually when we have that first appointment together, I will talk to you if you've ever had Botox or a filler in the past, because it's important to talk about, what you had, what you liked, what you didn't like, filler type, a lot of things have changed. And things like that. Like, something was weird.
I don't know.
If sometimes too, if I can reach out to the provider, if there's a good relationship there with you and them, sometimes it's nice to get that baseline. Say you've moved and you're like, oh, I always went to this doctor or esthetician in Chicago or whatever. Reach out and kind of talk to them about their product, their placement, and see if there's any starting point to help us kind of kickstart treatment.
Yeah.
So.
Know what did not work, so we don't do that.
Right. Yeah. The more information we have, the better.
Okay. Now, who can apply Botox?
Yeah. So licensed healthcare providers, obviously you want them certified. So that ranges from, your medical provider being a PA or a nurse practitioner or an MD. Then we get into the dentist. You have some estheticians depending on their licensing.
I think that has to, I'm sorry
No.
to interrupt, but I think they need to have some
Like
kind of
an
medical license to do it,
Right.
not just any esthetician.
No, it's got to be like someone who has a national provider number. So that, and you want to make sure they're obviously certified.
Certified. Yeah, that they know what they're doing.
Yes.
Like, and it's okay to ask the questions if you, whoever you're going, it's your right to know.
Yeah.
Like, just ask.
Right?
Like, okay, where did you, like, what would the questions be that they should ask? Like,
Yeah.
direct.
I guess, so first of all, you definitely want to go to a provider, any provider, so like your doctor, your dentist, your nurse practitioner, someone that you feel comfortable with. And if you have any question, regarding their care or what they're giving, sure, you can ask like, oh, what training did you go to, or where did you get certified? Would be a basic question. I think too, it all depends on who you're going to. I've never had anyone ask me like, well, where did you get certified? Because they trust me. They trust me as a dentist, a doctor, that I'm not just going to willy-nilly like, no, I have a medical degree. I'm just going to throw it in there. So, yeah.
So just...
it's fine to ask the question, but it's usually, if you're questioning their care, there's something up with that relationship. I'd be,
That's true. That's true.
I'd be like,
yeah. It's just
so.
Yeah. All right. What should I look for when searching for a Botox expert? I think that's pretty much it, right?
It's right. That's such a. I was been really thinking about that one, and the only thing I can think is just personal experience of, like, I tend to go to female providers because I just feel comfortable. I feel like they can understand me, my body a little bit differently.
Right.
Can look at my face or whatever and have that kind of female perspective. And other people, might feel more comfortable with male providers. I think too, having that consultation will give you a good feel for your provider, their thoroughness. Are they just like a get you in, get you out, boom, 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 here we go, bye? Or are they taking the time to, look at everything, talk about, those expectation, things like that. And maybe you're looking for just like a really quick in and out. I'm going to tell you, our first appointments are not going to be that. Maybe after we get to know each other, it is a lot quicker because we've established that relationship. We don't have to go through all of that kind of red tape of pre-talking about things, and we've figured out what works. So I think just getting yourself in someplace and then seeing how you vibe with that person. If you don't, it's okay. Like, that's fine. That relationship is not there. You want that because this person is working on your face and you're putting it in their hands, and that's really important. So, yeah. Don't know if that answered it.
No, I think that's a really good answer, because it does matter, like, how comfortable you are with the person, how you see how thorough they are. For me, it is very important because I'm kind of like that. I've had people tell me, wow, this is like going to the doctor when I'm doing my consultation, but I really want to customize the treatment for you and what you need.
Absolutely.
So I think that's very important. All right. We're going to start with some questions from our guests. One of it was, how long have you been doing Botox?
So I started administering Botox in 2019.
Okay.
Yeah.
And do we have any more, Jen?
One question, when you talked about cost per unit. There's also a consultation. Is there a separate consultation fee on top of then the toxin?
Not at this time. Nope, my consultations are free. Because sometimes, like I said, I'll apply it right then and there. I don't know. I just haven't. I didn't even think of that, and I just, not at this time.
So it's really going to depend on the provider in that case.
Yeah. Probably. So for me, I'm sure some providers do, because it is like chair time or salon time. But
the other one in concert with that, the initial or the base cost, you said if somebody was coming in for the 11s, you said it's normally you use 20 units. That's around $300, or explain.
So a unit cost, if we're doing something like Xeomin, which is just another botulinum toxin. I do $15 a unit is what it's based on. And in someone with really high activity, I normally err on the side of one of the higher doses, which is 20 in that area. I have people that we put very minimal, like 8, because they don't make that motion very much. But the thing is, when we work on your frontalis or your forehead lines, you have to do these in concert with that. Otherwise, these are going to start to regroup and get stronger, and you start to get this thicker brow because those muscles are like, hey, we got to make up for not being able to move the forehead. So that's where those kind of dosages are totally person
So
dependent.
that kind of break that down then for someone who's listening
Yeah.
to this live. So if you're doing that with that, based upon the unit and the unit cost, it would be about what average cost?
Ooh.
It's gonna depend on the person.
Totally.
because,
Yeah,
it
like
just-
I have an assistant that we
Yeah.
might do 8 here and 4 up here. But again,
You can do
totally depends
20,
on her.
but
Yeah.
it's really hard to
yeah.
pinpoint exactly how
Yeah.
much it would
But
be.
each unit costs a certain amount.
Correct.
Which is again,
15.
that's,
Yeah.
okay, that's
Yeah.
what I was getting.
Mhm.
Yeah. And
Yeah.
again, it really depends on the provider.
Yeah.
Too.
Totally provider dependent. Mm-hmm.
So
Yeah.
okay, so another question that we had, what's the shelf life of the toxin? Like once you have it, like what could you elaborate that, Jenna, that question?
Well, where does the toxin come from? I've heard that there's only one place in the world where the toxin is, it was in Ireland or something where it comes in. So you've got that, where do you get your product? And I guess that
Yeah.
depends upon the shelf life of that.
Yeah, so
Right.
I purchased mine through Allergan and Mertz, which are like aesthetic companies that sell botulinum toxin. And it's in its powder form, so it comes in a powdered form that has to be rehydrated. So that powdered form lasts a really long time. It's in a encapsulated vial, and then you rehydrate that with saline or whatever product. Some people use lidocaine, again, depending on what you're doing with the product. And then the shelf life of your product, once it's rehydrated, is about 4 weeks.
So if the product, the Botox itself is coming from, say, Ireland, where they produce it, since it's in powdered form,
Yeah,
it probably does have a very long
long
shelf
time.
life.
Absolutely.
Okay.
Yep. Like year.
Yeah,
or so
usually
on the bottle.
powders last you long. Like even like in your makeup, like your powders,
Yeah.
if it still looks good, doesn't smell funny, it's
Yeah.
probably fine.
Yeah, and they have, just like any other kind of medical grade object, an expiration on it.
Right.
And you just don't touch it and use it if you're on or after that.
Yeah. All right. Do we have any more questions, Janet?
You mentioned something about a reaction that can occur, obviously. I'm going to call it the lazy eye. The
Yeah.
eyelid that would droop.
Mm-hmm.
That is not a permanent,
No.
okay. I think a
No.
lot of, you hear things, and you just want to make certain that you're not going to have a problem down the road.
Right.
Mhm.
So there's
Right.
nothing that would really cause a permanent
Correct.
situation to occur to the face.
Right, and that's the beauty of Botox, where it has that kind of tapering effect. And usually we'll find that if anyone does get that kind of extra hooding or laziness of the eye, it won't last that entire 3 months. They'll
Got
start
it.
to get, slowly a better effect at that point. But again, I had followed someone on Instagram. It had happened to her, and where she said her practitioner placed it, I was just like, could not pick my jaw off the ground fast enough. I'm like, why there? It was like 101 of something that I was taught to never do. So again, you take a lot of precautions on placement and dosage to make sure that that doesn't occur. Yeah, because that's scary. No one wants to walk around like that.
No.
It is. And I feel really bad if anyone did. But it
Yeah.
can happen. And we just, again, talk about it and manage that if it were to occur.
We have someone who's asking
Yeah.
where they can get the Botox service.
Yeah.
So yeah, that would be like one of our final questions. Like, if anyone
Yeah.
wants to get in contact with you, how how can we find you?
Yeah, how can you find me? So that's a great question. I'm going to give Lizeth my cards and information. So if you have an appointment with her and you want to pick up my card, that's one way to get it. You can contact our office, so Schindelholz Dental, where you can find us online for our phone number, and you just call, and the gals have this kind of list of intake information, so they'll talk to you about who you are, your phone number, if you've had it before, get you scheduled for an appointment. Usually I'll take, depending on once I read, if you've had it before, if you're coming in like knowing exactly what you want, maybe that intake consultation will be a little bit quicker. But if you're totally new to it and you're just trying to explore, we might take a little bit more time together. So again, patient dependent on kind of your history of things. We will determine together how much time we need in that initial appointment. So yeah.
Is there any more questions? Well, that was great. That was fun. Thank you so much for being here.
Thanks for having me.
Yeah, you're welcome.
So wonderful.
This was awesome. We should probably do one for fillers. That'd be interesting. We'll see what people would like to have or not have.
Yeah.
And if anybody would like to have her information, just reach out and I'll be happy to provide it for you. And that was it. Is there anything you want to say to?
No,
people?
I just really appreciate you, taking the time with me to talk about this. It's super fun to talk about. When I was going through the questions, it just reignited. I mean, I've always known how passionate I am about this, but it's just so fun to kind of, share with people. And it really helps with, that self-confidence or just feeling kind of better about yourself. And I enjoy that kind of self-care concept of, just the whole body and mind. So,
and doesn't it surprise you, like, what you find out that when you're trying to explain it?
Yeah.
Like, every time I find, like, oh, this is just common knowledge. But when I'm trying to explain it just becomes like, oh my God, no, this is too much information. I gotta cut it down and everything.
It can be overwhelming, but So.
All right. Well, thank you very much for for being here.
Yeah, not a problem.
And thank you very much, everyone, for joining us. This will be recorded. Well, it is being recorded, so it will be permanently on our website. Not our website, our Facebook page. And we'll probably have a link from our website to the Facebook page so you can rewatch it. And any other questions that you had, you can just put them in the comments. Actually, if you're just watching this on replay, just let us know that you're watching it on replay. Just do replay on the comments or something. And we'll also put Laura's information there, or just can reach out.
Yeah, absolutely. I'd be happy to answer any questions or talk more if people have questions, concerns.
Awesome. Awesome. Well, thank you very much.
Yeah.
Thank you, Janet. Thank you, everyone.
Thank you.
Let's slide this stuff.